Hi all, we're on this concept of health and wellness. We did do this last week. While I scroll down, remember all those median scores still? Closing time is tomorrow. So please get them going. If you have questions, WhatsApp me or privately WhatsApp me and I'll help. We're going to do 3 things today. This is one of our last weeks left. I think after today there's 2 weeks left. With 117 I'm done. Guys, so I'm not going to send you any more clips on 117. I'm going to do probably one more clip on it and then on just exam prep. And then what I'm also going to do is I'm going to have a Zoom. I think we must have a Zoom on Friday. I haven't seen you for so long. You also don't know how I look. You know, in lockdown I don't have to shave. I don't have to do anything. So let's see. Can we do it Friday at 12, please? I'll open it up. I'm going to ask Nomkita to join us as well. What I want to do on Friday's Zoom, I want to actually go over 117. I'll do a clip for you tomorrow or the day after on your SAS, the presentation. And then you need to prepare for this Zoom. Okay, some good advice I got from one of my lecturers. We need to prepare for the Zoom and then you can ask me questions. And if you're quite happy and you know what to do, you don't want to ask me the question, WhatsApp me, privately WhatsApp me. I don't really care, but this is now bump and grind time. Only about a month left. Right, physical fitness. Now, the World Health Organization defined it as not only the absence of disease. I mean, I'm skinny. I don't train currently. I started last week again. That doesn't mean I'm healthy. Okay, so being physical, active and fit does not always say you're really unhealthy. There's a lot more components to that. Now, they divide basically it into 5 major components when it comes to fitness. And they pick these because they say one must be able to perform your daily activities with vigor and alertness without undue fatigue. You need to have quality of life. That's what it boils down to, guys. That's where we come in. We can actually offer a cardiovascular training program, flexibility, body composition, sir. Okay, I'm not that good with diets. I can give you guidance. Perhaps you should see a dietitian or a nutritionist or a herbalist or whichever thing you should be best, you think should be best for your client. And then maximum strength. We must be able to pick things up. And then strength endurance. So you know what endurance is. Strength endurance, the ability to continue doing a specific activity through a period of time. That is walking. Is one of them. Okay. You need strength endurance to walk. Perhaps not as much as when you're 20, but if you're 70 and 80, it starts to play a role. Maximum strength, things you haven't thought about. And when you're in your 20s, I'm in my 50s, I see clients in their 80s and 90s. They cannot get up from a chair. Now, I can be nasty and say, can you get up from the loo? So if I go to the loo and I don't have the strength to get up, just think of my dignity. Sarah, I have to call my wife or whoever. Come, please help me, pull me up. Guys, body composition, it has a lot of components. You know, endomorph, mesomorph, ectomorph. So that's your muscular component, your fat component, your skinny component. Are you overweight? Are you underweight? You did fat percentages, height, weight, circumference. It's flexibility. I underestimated the value. If you cannot reach, you're prone for injury. Okay. The lack of flexibility is really critical. As we get older, it gets worse. And cardiovascular fitness, a lot of us think that's the most dominant component. And yes, if my calf muscle cramps, I can stretch it and it's okay. If my heart muscle cramp, I'm having a heart attack, I end up in intensive care. Sorry guys, I had to stop there. My dogs was chasing some Adidas in the garden and it made a lot of noise. So, I mean, it's really an important component. If we don't have cardiovascular or cardiorespiratory, it's not cardiovascular, it's cardiorespiratory. So that means heart and lungs, our whole circulatory system. That's nice. Not only the heart, the respiratory system as well. Okay, so let's go on. Sport performances, definitely those are normal general things for having quality of life. In sport, different components. I mean, we all know in sport we'll need endurance, speed, power. And your sprinter will have to have speed and power, where your gymnast needs different one. And so it's sport specific. That also guides us in our how we choose our sport. let's look at these 5 components. I just highlight them a little bit, all 5 of them. Nice, you can add to them if you want to. I mean, look at the athletes, putting in a bit of speed, agility, all of those things over there. We need a lot more of them. Explosive power, plyometrics, you can add them. If you go to this one now, the holistic approach is one we hear in schools, mind, body, and soul. The Greek word comes from holos. It's about the physiological, the social, and the environment, and the spiritual. So yes, physiological. How do I socially interact? I think with all these mediums, even my class, interaction, the environment around us. In George, it rains the whole day. Today is a beautiful day. And the spiritual factors influence each person. Guys, and they directly affect us. There's also the natural law, the made of independent parts. So we can't separate them. The physical, the mental, the emotional, the spiritual, they all are together. You can read through the rest. It's just for me quite important, if we go a little bit lower, that actually a shortening in the one can lead to negative characteristics in the others. So I might be physically aggressive. I may be low in my physical attunement. Suppression of emotions, low self-complexity. So a lot of the times hypertension and social support. I mean, hypertension is a lot of times a disease. Yes, it can be genetic, but if I eat a lot of salt, if I eat the wrong foods, if I'm inactive, if I'm overweight, if I smoke. So if I have a social community where I fit in and we smoke and we drink and we don't eat, the chances of having that is quite high. If I'm in a high stressful job or I've got a lot of stress, I think you guys are going to go through a stressful period now the next month. It may lead to infectious illnesses. Wounds may struggle to heal. Guys, heart attack and high emotions. I'm really stressed. Peter, I got to give this speech. My heart rate goes up. I sit sometimes before meetings and I can hear my heart rate going up. And then physiologically, hardiness. You get it sometimes in work. People can really, how's the word now? They know what they want. They know what they want to do. They know how to organize people. They are really, I don't want to say hard in their profession, but they're goal-orientated. They go-getters. They do exactly. And they don't really care what they do to other people. And then absenteeism, I may be absent from work. How many days? Those type of things. Sense of worth and life expectancy. If you don't think, I'm wasted my time on earth, I shouldn't be here, then your life expectancy will be low. If you've got purpose and goal and you know where you're going, it makes a difference. Pets, guys, pets can actually. I once attended a meeting and a guy came in there. It was in some fancy, I want to say Arabella hotel, a 5 or 6 star hotel, and he came in with his dog into the lecturing room, and his dog was there because the dog can actually sense when he's going to have a fit. So the dog must be around him the whole time. It's basically a working dog. I must say the dog weed in the hall, and it was a bit of a mess. But pets, just think about elderly people. Think about walking with your dog. We underestimate the value of pets. A lot of times we have pets when we're kids, but they are really a companion. Disease prevention versus health promotion. If you read it, this guy is saying, I concentrate on heart disease prevention rather than on saving the lives of 150 people. I find it in my profession as well. I'm a biokineticist. I can't remember somebody's name, but I remember he's a knee or a shoulder or a hip, and it's the wrong way to go about it. I need to go into more treating my patient holistically than only a knee. So a statement like this, you can read that. Technology, medicine has a limited of extreme cost, whereas disease prevention is far more cost effective. This is where we are. If I can make my client enjoy his physical activity, train regularly, I prevent cardiovascular disease, pulmonary disease, heart attack, strokes, bypass surgery. We are really in a preventative medicine. Now I'm struggling with English again. Our job, if I say job, I didn't want to use the word job, is actually one of the jobs that does that. And if I can prevent illness, I increase quality of life. And that is with a lot of money. A lot of times I tell my client, when you were working and you were in your 20s, 30s, 40s, 50s, you use your health to create wealth, but you didn't train, you didn't look after your body. Now you need to use in your 60s, 70s, and 80s, you need your wealth to create health. Guys, so train regularly. That's all for today. We'll do this future trend in health and fitness next week, and there's still another. I'll do some SAS discussion. We need to do one before the exam as well. Cheers, guys. Enjoy.